In this video, we are going to learn about the current procedural terminology. So, CPT is a set of codes, descriptions, and guidelines intended to describe procedures and services performed by physicians and other healthcare professionals. It is developed by the American Medical Association or AMA. This book is first published in 1966. CPT contains 5-digit numeric codes, for example, 52,000, which are Category 1 codes. It is updated annually and January 1st is the effective date for use of the updated CAPTAIN. Place of service codes are used in professional claims. These codes should be used on professional claims to specify the entity where services were rendered. Place of service codes needs to be checked with individual payers, for example, Medicare, Medicaid, or other private insurance for reimbursement policies regarding these codes. CPT has Category 1 codes and listed in 6 sections: 1. Evaluation and management, 2. Anesthesiology, 3. Surgery, 4. Radiology, 5. Pathology and laboratory, and 6. Medicine. Each section is divided into subsections with anatomic, procedural, condition, or descriptor subheadings. CPT defines healthcare professionals as the physician or other qualified healthcare professional, who is an individual who is qualified by education, training, licensure or regulation, and facility privileging who performs a professional service within his or her scope of practice and independently reports that professional service. And clinical staff, who is a person who works under the supervision of a physician or other qualified healthcare professional, and who is allowed by law, regulation, and facility policy to perform or assist in the performance of a specified professional service, but who does not individually report that professional service. After Category 1 codes, let's understand Category 2 codes. These are performance measurement codes. The use of Category 2 codes is optional. Category 2 codes may not be used as a substitute for Category 1 codes. And they don't have an ARVU associated with them. Category 2 codes are 5-digit alphanumeric codes ending with alphabet F. These are released 3 times a year with an effective date of 3 months after release. Next are Category 3 codes. These are temporary codes for emerging technology. Category 3 codes are also 5-digit alphanumeric codes ending with alphabet T. They retire if the procedure is not accepted as Category 1 code within 5 years. Also, AMA guides to report Category 3 code for a procedure, if available, rather than reporting unlisted Category 1 code. Category 3 codes are released twice a year on January 1st and July 1st with effective dates 6 months after release. Format of a CPT code is that the 5-digit code is followed by the code description, for example, arthrotomy, wrist joint, with biopsy. The subsequent code of the same family contains a description after the semicolon, for example, with synovectomy. Now, what is an add-on code? Add-on codes are designated with the plus symbol and listed in Appendix D of the CPT book. These codes are identified by phrases such as each additional or list separately in addition to primary procedure. The add-on code concept applies only to add-on procedures performed by the same physician. These add-on codes describe additional intra-service work associated with the primary procedure, for example, additional digit, lesion, neuropathy, vertebral segment, tendon, or joint. These procedures are always performed in addition to primary procedure, thus never be reported as a standalone code. Finally, add-on codes are always exempted from Modifier 51. Next, what are modifiers? A modifier is used to report service or procedure altered by some specific circumstance but not changed in code definition. Common scenarios for the use of a modifier are: the procedure had both professional and technical components, commonly in radiology. Procedure performed by more than one physician. The procedure increased or reduced. Only part of the procedure performed. Bilateral procedure performed. The procedure performed more than once. All the modifiers are found in Appendix A of the CPT book. Now, let's understand about an unlisted procedure codes. It is recognized that there may be services or procedures performed by physicians or other qualified healthcare professionals that are not found in the CPT code set. Therefore, several specific code numbers have been designated for reporting unlisted procedures. Each of these unlisted procedural code numbers relates to a specific section of the book and is presented in the guidelines of that section. In some cases, alternative coding and procedural nomenclature as contained in other code sets may allow appropriate reporting of a more specific code. CPT references to use an unlisted procedure code do not preclude the reporting of an appropriate code that may be found in other code sets. Time, an important factor in assigning CPT codes, especially in the evaluation and management section. CPT code set contains many codes with a time basis for code selection. As per CPT, time is the face-to-face time with the patient. A unit of time is attained when the midpoint is passed. For example, an hour is attained when 31 minutes have elapsed. A second hour is attained when a total of 91 minutes have elapsed. When another service is performed concurrently with a time-based service, the time associated with a concurrent service should not be included in the time used for reporting the time-based service. Some services measured in units other than days extend across calendar dates. When this occurs, a continuous service does not reset and create the first hour. However, any disruption in the service does create a new initial service. For example, if intravenous hydration code 96360 Oregon 96361 is given from 11 p.m. to 2 a.m., code 96360 would be reported once for the first hour and 96361 twice for each additional hour. For facility reporting on a single date of service or for continuous services that last beyond midnight, that is, over a range of dates, report the total units of time provided continuously. Then there are symbols used in the CPT book for code revision, new or revised text, new code, modifier 51 exempt code, add-on code, a procedure including moderate sedation, vaccines pending FA approval, resequenced code, reinstated or recycled code, and telemedicine services. Each of these is documented in specific appendix numbers as shown here. At the end of the CPT sections, there are several appendices given. So, Appendix A is for modifiers. Appendix B is for additions, deletions, and revisions. Appendix C is for clinical examples. Appendix D is for add-on codes. Appendix E is for modifier 51 exempt codes. Appendix F is for modifier 63 exempt codes. Appendix G is for codes include moderation sedation. Appendix H is for alphabetic clinical topics listing. Appendix I genetic testing code modifiers. Appendix J is for electrodiagnostic medicine. Appendix K is for pending FDA approval. Appendix L is for vascular families. Appendix M is for renumbered CPT codes. Appendix N is for resequenced CPT codes. Appendix O is for multi-analyte assays. Finally, thank you. Please like and subscribe to this channel if you like our videos. Don't forget to click the bell icon for new video notification. Thank you.